Welcome to Western Perspective. I'm Matt McKenzie. As Western Australia is heading towards the journey of relaxing lockdown restrictions, many are hoping this week that things will return to normal. But the reality is far from that, and WA's Chief Health Officer, Andrew Robertson, is warning young people not to be complacent. During an exclusive interview this week, Dr. Robertson answered questions on young people's concerns about the coronavirus, his experience of working closely with decision makers, and what the future looks like for this generation.
Andrew Robertson, thanks for talking to us today.
Thank you.
After 7 weeks of lockdown measures, are you relieved that WA is finally stepping back into the normal?
Yes, obviously I'm relieved. I think we've obviously had a good outcome so far with the first wave, and we're now starting to move into reducing the restrictions going forward. But obviously we need to do that still very carefully because there's always the potential for further outbreaks going forward.
As soon as the lockdown measures are being relaxed, there's a sense of relief within the community. But are you able to tell us what are the risks if people do not follow the rules?
Well, the risks are that we will have the disease either introduced back in the community, so a lot of our border controls are very important. Or we may have outbreaks within the community, related to other cases, and no system is perfect, and no border controls are totally perfect. So, what the risk is that those cases will enter the state, and as people are mixing more, there's more larger gatherings, there is a risk of bigger outbreaks. So we have to be very careful about managing the risk going forward, otherwise we run the risk of having another wave, a second wave.
What do you have to say to young people who just don't care about the rules?
Look, the rules are about protecting them, but they're also more critically about protecting their friends and family, and they may not think that the rules are important, but it is around the interactions that we have with each other. So every day we go out, and if they're going out to visit friends, or that they're interacting with those friends, and then they're meeting people as they go to work or go to sport, and if they become infected, it may not impact on them greatly, but it will impact on others within the community, and that might be family members, it might be friends, and if we get a major outbreak, then we will have to consider whether further restrictions are required, and that will certainly impact on them.
There are no evidence of community spreading at the moment, but the community still have some fear around this, and it sort of feels like chasing shadows to a certain extent. What do you have to say to young people? What assurance you can give to them?
Look, I think the assurance is that we're not seeing any evidence of community spread at this stage. But what we are doing is increasing our testing. So we've been testing quite a lot particularly over the last 2 to 4 weeks, and that continues to increase. So, for example, on Tuesday we did nearly 1,900 tests in WA. So we're not walking away from testing. We're not assuming that there's nothing there, because we know that it only takes one case to come back in for it to start spreading again if we don't identify those cases. So, and we will continue to enhance our testing going forward.
You've been working very closely with the executive level of government. Are you able to give us some insight as to the inner workings and how does it all work?
I can't say obviously a lot about the executive level of government, but I obviously work very closely with the Health Minister and provide advice to the Health Minister, and through the Health Minister provide advice to the Premier and to Cabinet. So as part of the arrangements, the State Disaster Council meets, it's been meeting at least weekly, but earlier on it was meeting often, at some stages daily. And they obviously, we provide, as a public health advisor, I provide advice on the kind of measures they may like to consider, whether that be when we were closing down the society to a degree, or whether we're easing the restrictions going forward. I also work very closely with my colleagues in other jurisdictions and with the Commonwealth Government, so with the Chief Medical Officer in the Commonwealth Government. So it's in that context. So the advice we provide is both based on our unique state position, but it's also based on Commonwealth, agreed positions at a Commonwealth level.
On the matter of decision making and policy making, they always talk about based on medical advice. Are you able to, I suppose, elaborate a little bit more as to say, how do you come to certain medical advice, for example, schools, and when it comes to advisory bodies like the AMA, which is the Medical Association, what sort of contribution do they make, and how does it all comes together?
So what we do is at a national level, and a lot of the decisions and the advice we've been providing has been done at a national level, is to actually look at the evidence base behind it. What is happening? So, now obviously this is a bit of an unusual situation. We haven't seen this virus before, so a lot of it has to be based on what's happening in other parts of the world. But there is a lot of good research that is being done now, and we've been able to look at, and we've determined that as a group, particularly if we use the school children as an example, the way this virus affects them is quite different from adults. So this is as a group. Now, if you were to look at something like influenza, you'd be very concerned about the kids because it tends to be the very young and the very old who get very sick. But in this one, the very young, the young don't get very sick, and they don't appear to be very good at spreading the disease either, which is a bit unusual because that group often is quite effective at spreading disease. So we have to tailor, as with all responses, we have to tailor our responses around the evidence, and that's what we've been working to do. Now we work very closely with modellers, we work very closely with our expert advisors in the Communicable Disease Network of Australia to get that advice, and they obviously link into our universities and other experts. The Australian Medical Association has an input. They are representing their members. They obviously need to protect their members, and they're an important contributor in asking questions. Some of which we don't necessarily agree with all of their positions, but certainly respect their right to ask those questions. And some of those are difficult questions to answer, and we have to continue to work at what is the solution. And we continue to learn and develop as we go through this process.
With the implementation of the 4 steps plan being announced,
yes.
Step 2 is coming this week. So what should Western Australians be aware of? Because it does look like normal, but it's not.
It's not. So in phase 2, a lot of there's a couple of focuses, but one is opening up the borders to a degree. So that is to allow a bit more travel, so people can go into the southwest or the Great Southern. If you're in the Pilbara, you can go down into the Gascoyne or the Midwest, or if you're in the Kimberley, you can move across. So an ability to travel, ability to obviously catch up with family or friends, or take a bit of a break in one of the other areas. So that's one of the steps. The second one is around opening up, trying to start to open up restaurants and cafes, and that was a deliberate effort to try and do it. Now, some cafes and restaurants are frustrated because they sort of say, well, we can't open for 20. But we have to do this in a staged way, and we appreciate that some of the very big restaurants may not be able to open up for 20 people. But many others will be able to open up, and it's a good first step. And then a lot of the other stuff was around starting to open up for exercise, both indoors and outdoors, to allow people to start to get back to some of the things that they did. Exercise is important, and as are some of the community groups, and to start to interact a bit more. But again, within restrictions, and this is very much around how do we enable the society to open up, but also to do it in a graduated way. And then we will measure this. We will be looking very closely at what the response is, making sure we're not seeing any further outbreaks, If we do see further outbreaks, and we are able to control them, that's fine, because we may get small outbreaks. But if we get, evidence of community spread, then we may have to again, move carefully until we get that back under control.
So what does the future look like for you, particularly when it comes to the level of spreading or the future outlook of the virus in WA?
Look, I think it's an interesting phase of the virus. We're obviously in that phase where we've managed to get it under control, both in WA but largely across the country. And we're in a far better position than many other countries. But the virus hasn't gone. It obviously is still very evident around the world. So we've now in this phase where we need to try and open up society to get it back to working, because obviously it's having a serious social and economic impact, get it back to working without getting any further significant outbreaks of the disease. And if we can do that, and do that over a reasonable period, we'll then be looking at what is, hopefully working with, through research at developing either treatments, effective treatments, or working on an effective vaccine.
So finally, what's your message to young people, particularly during this period, because the state of emergency is not over?
Look, I think the message is, as you say, this isn't over yet. We really need to. The measures that people have put in, and many of those measures like hand hygiene, cough hygiene, the social distancing, have had amazing effects on respiratory virus. But it had an effect on coronavirus. But it's also had an effect. We've seen some of the lowest levels of influenza we've ever seen. We're seeing some of the lowest levels of respiratory syncytial virus we've ever seen. So it is working. It's obviously affecting respiratory viruses, but that can be undone. And we ask, it's around people not becoming complacent, not assuming that we've managed to win the first battle. We haven't won the war. We need to remain. We can't become complacent. We need to keep working to get that balance between, a working in a functional society, but not allowing this virus to get away from us.
So constant vigilance is the only option?
Yes, constant vigilance. We will not be decreasing our vigilance on this. It's still going to be the key focus for the Department of Health and many other agencies, until we have a real solution to this virus.
Andrew Robertson, thanks for talking to us.
Thank you.
With hundreds of thousands of Western Australian families stuck at home in recent weeks, hobbies some may consider as out of fashion are having a renaissance. A model shop in Myree has been steaming ahead with a surge in new customers as adults and young people alike are looking to new toys to fight boredom, whilst parents are trying to find something new to do with their kids.
So for us, I think we've been one of the very fortunate ones, whereas we cater for a wide range of hobbyists, and that has kept us going through the time. All of our hobbies are ongoing. It's not a one-off thing that people come in for. And we just say once they've been in the store, once you're hooked. We've been in this store for 3.5 years now. Prior to that, we were in South Street in O'Connor. So we specialise in all of the mainstream hobbies, trains, plastic models, model aeroplanes, lots of cars. Cars are the most popular still. And then we do a range of games, puzzles, other entertainment things for kids as well. And Lego has been huge. From the day that the lockdown started, we've been extremely busy. The people that are normal, regular customers have been in a lot more often, buying, especially the modelers. We've seen a whole new range of customers, which is more the families that traditionally aren't hobbyists coming in and looking for stuff for their kids to do. And then obviously puzzles. I think in the first week, a whole puzzle aisle was cleaned out in 1 week. Most of our hobbies are continuous. So like if you're flying, for example, you're always building another aeroplane or doing things on your aeroplane that you've got already. Trains is obviously a lifelong thing. The guys that buy the radio controlled cars, normally it's the father that will buy one, and then you'll come and get one for the children. We cater for a wide range of hobbyists, and that has kept us going through the times. I think people get satisfaction in seeing something that they've actually physically done. There are other things that you can entertain with, and they're family orientated, because dad and the sons can do it together, moms and the girls can do it together, and they're family orientated. It's a lot of youngsters building plastic models. I think the TV games and whatever that they play, once you're done, it's gone. Whereas if you build something, you physically got it in your hands and you can actually see it. I think a lot of hobby shops haven't kept up with the times, and they don't have good websites, and they don't have the stock. I mean, we're fortunate that we've got a lot of stock, and also we're always innovative. We're always getting new stock. We're always getting the latest things. It's going to change a lot of people's lives. In that they've now started doing something, and we've got a good loyalty system as well. So we put people on our loyalty point system, and we just retain them. I think once they've been in our shop, they all come back.
And that's all for this week. Thanks very much for joining us. We'll be back next week, but for now, it's back to you, Ivan and Sarah.
Thanks, Matt. This week's main news again. As WA is spearing ahead in the fight against coronavirus, our Chief Health Officer is warning young people that achievements can be undone and constant vigilance is the only option. During an exclusive interview, Dr. Robertson also gave an insight into his experience of working with decision makers and how certain health policies came about.
And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Until 5:30 next Sunday, look after yourself, stay at home and have a pleasant evening.
Take care.